is complex regional pain syndrome? Complex regional pain syndrome is a disease or reflex sympathetic disorder. Symptom is a process disease of the automatic nerve system. It is ranked the most painful disease in the McGrail pain scale. In CRPS, pain is characterized, constant, and extremely intense. This is the McGrail pain scale, and your first child labor is labeled into a 39 pain, and CRPS is labeled the highest on the McGrail pain, which it has a lot of pain, and there's other diseases, the pain, that scale of pain. History in CRPS. CRPS was first reported in 1864, but it was not until 1971 that CRPS was discovered in a child. CRPS was found in the Vietnam soldiers back then. The wounds of some soldiers would heal, but the doctors didn't understand why some of the other soldiers' wounds would not heal. In a large study that scientists did, CRPS is more common in girls, 70% of the time, and the mean age of the diagnosis is 13 years old of age. Range, it can happen from a little girl from 5 years old to 17 years old. Symptoms of CRPS. First, there are 4 common symptoms of CRPS. The first is constant chronic pain, burning pain, inflammation, spasms, and insomnia. There are 4 stages in CRPS. The first stage is called the acute stage, and it lasts about for 3 months. It consists of stiffness, pain, coolness, hair and nail growth, and limited mobility. The second stage is called the dystrophic stage, and it lasts 3 months to a year. The affected limb may still be swollen with excessive accumulation of liquid, cool, discolor, or different shapes. Stage 3 is called the atrophic stage, and there is no limited time at this stage. At this stage, many patients are likely to be effectively treated with blocks, as the percentage of sympathetic independent pain is much greater than the percentage of sympathetic medicated pain, meaning the majority of the pain signals are now originated in the brain and not at the original CRPS site where a local block would help. Stage 4. Most people never advance to stage 4. In stage 4, there is an involvement of inner organs. This stage, there is a risk of amputation. When amputation is done, it is done because it was infected and extremely destructive. Amputation stops the pain and the risk of spreading where there is amputation and where amputation can't be done. How is CRPS diagnosis? CRPS is best diagnosed by a neurologist. Most of the physical doctors really don't know much about this disease. A neurologist is a special doctor who is specialized in nerve problems, bones, and muscular. What method diagnoses CRPS? There are many methods to discover. Exams done by MRI, CAT scan, X-ray, and a MG can be diagnosed with CRPS. Most are accurate in showing the damage. I got a bone scan, which is not really fun to get. Treatment for CRPS. There are many ways to treat CRPS, but some are typically not for a long time or what the disease doesn't accept the treatment. A nerve block is one of the treatments that mostly works. There's still no cure for this disease, but they're trying to find one so they can stop it from spreading. A nerve block. There are many types of nerve blocks. The one that I had was called a lumbar sympathetic block. The lumbar sympathetic block is an injection in the sympathetic nerve tissue. The injection is next to the spine. The injection consists of local anesthetic. The procedure involves inserting the needle through your skin and deeper tissue. Most patients and I receive anesthesia to make the procedure easier. The injection is done with patients laying on their stomach and monitoring their blood pressure pulse. I have an incurable disease, but the disease is not happy.
Does anybody have any questions for Judy?
What stage are you in?
3.
you like have to like wear those things again?
I wear them at night. I don't like wearing them at school.
How come you don't wear them at school anymore?
Because they told me to wear it only 12 hours.
Only 12 hours.
Yes.
When were you diagnosed?
I was diagnosed September the 21st. But I had it since July the 6th. Yes.
When you start treatment for it, like
Probably a month ago.
has it worked pretty good?
Well, the nerve blocks help, but like now I just got a nerve block I think 2 weeks ago, probably 3, but now it's back because the nerves don't like the treatment.
So, oh, sorry. Are you in pain?
Yeah, there's pain, stiffness, numbness, and coldness. Yes.
Were you scared when, like, it first started getting swollen?
Yeah, because my hand was the one that's swollen and I can't do anything. Well, I couldn't do anything with it. Now, with therapy, you get therapy, which helps you, but when you're getting therapy, it hurts a lot because you're in pain.
Anybody else have any other questions?
Yeah.
Could it be, like, lifelong?
Yeah. This girl, she's from Georgia. She was diagnosed when she was 2 years old, and she's now 14 years old, and she still has it. Yes.
Could you outgrow it like when you get older? Could your like immune system or whatever get stronger and like?
Well, it's not that your nerve system. My nerve system is there's one nerve that's called your sympathetic nerve, and it's in charge of the help with the blood vessel, and like that nerve doesn't work, which is not working, and that's why it causes my life not to get blood accumulates the blood in one place, so I don't have it in all my leg. That's why.
Is that your hand on the PowerPoint?
No, I got it on the internet.
But I do like that thing on the PowerPoint because it is so important that you not feel sorry for yourself and get down because you have a disease, because it is something that you can get some treatment for and get some help and relief with your physical therapy and stuff, right?
Yep.
Yep. So that's good.
Yes.
When you get the shot, will it take the pain away for a while, or is it just like?
When you get the shot, everything's back to normal. But when the shot goes away, because they don't know how long the shot will last, it can last probably an hour, and then you can be back again.
So then would you get another shot, or do you have to wait so long to get another shot?
I have to wait so long to get another shot.
And you told me you're recently going in January, right, to do...
I'm getting hospitalized for a week to get treatment, which is another nerve block, but that is, it uses something else to try to see if my nerves will react to it, which they're trying to do, but if it doesn't work, they're trying not to get me to stage 4, which were there, they will have to amputate one of my legs.
Mm-hmm.
But they're trying to figure something out. And in New Jersey, they haven't especially found a cure, but there's something else that they can use. But I would have to go to New Jersey and try it.
So how many people have CRPS? Is there quite a few people, or is this a rare thing?
In America, there's not very much people, but in South America, where there's more of nerves, there's more in South America than there's in another continent. There's more of people fighting, because if you hit yourself, which they don't explain why, if you hit yourself 3 times, they don't know why the second time would be the one that hurts your nerves, so they don't know why. In South America, there's kind of more people in America.
Okay. Right. Any other questions?
Yeah.
So are you born with it, or does it just eventually happen?
You're naturally happens.
But they think it's because like you had an injury at one time that caused
But
the.
injury can be since you were born, and it can be since you were 7 years old, but they don't know why now it happened.
Right.
That it didn't happen that when I hit it, like the first hour.
Yeah.
Just one day I was just walking, and there was my neck swollen. It was huge. Yeah.
Is it hereditary? Like, can your kids get it?
No.
Do they have like a certain amount of, like when they put the injection in, like your nerve block, is there like a certain amount of dose? They,
The injection is not really, it doesn't hurt because you have anesthesia, but like after it, and whatever makes it worse is the cold. You can't be outside in the cold. You have to have like a special sock or something to cover your leg, because then you're like, because it's already cold, you're gonna get it more cold, and there's more of your nerves don't get more blood into it, because the coldness doesn't help the blood.
does it make a difference to do sports then?
You can't do sports or anything that you can hit yourself, because like when they find a cure, I'll probably be able to, but I don't know yet. But I can't do sports or anything that has to do with hitting or anything like that. Yeah.
So is it just like in a certain spot of your hand, or is it your whole hand?
Well, I had it up to here when they did the bone scan. I had it up to here, but now I have it on my 2 legs, and I think just like now it's spread up to somewhere around here, but it was only up to here, but it's spread all over to my legs, my 2 legs. Yeah.
Could it spread like to your like entire body, like your head and stuff?
It can, and if it gets to your head, you get a brain damage. Well, it's not brain damage, but you get something in your head, and you lose your memory, and you lose, you kind of don't, you go like, you kind of lose your memory, and you don't, you don't remember anything that you did, or you don't remember your, like, going to school or anything that has to do with learning.
Any other question?
Do you know how much longer you have until you reach stage 4?
Stage 3 doesn't have limited, so I can be in stage 3 getting nerve blocks, getting medicine, I have 7 medicines I have to take every day, and those are the ones that are like painkillers, and they help me, but I can live in stage 3. But if it goes to an organ, sometimes, like if it goes to your stomach, they can't amputate it there, so we're there, they'll have to stop it from going up to my stomach. Yes.
So does it eventually happen?
It has eventually happened, but I hope not, it doesn't.
But didn't your PowerPoint say it's kind of rare to get to stage 4?
Yes, it's
Yeah.
rare to get stage 4 where I can live in stage 3.
Yeah. Okay, any other questions? All right, well, thank you, Judy, for sharing that with us. That's really nice of you.